Senator Portman, you online?
Thank you, Mr. Chairman. Secretary Becerra, thank you for being here. I would agree with what my colleague, Senator Whitehouse, just said regarding the Comprehensive Addiction Recovery Act and its implementation, particularly on the treatment side. We just did provide more funding for that in the omnibus, and unfortunately, with the opioid crisis we have and broader drug crisis, we need to focus even more on the demand side. I'm going to talk to you a little about that today. We have legislation also with Senator Whitehouse called the TREATS Act, and basically it permits us to do something that is working, which is to provide prescription drugs, medication-assisted treatment, in particular MAT, without having to go to a personal in-person visit first. So it's telehealth, and it's worked incredibly well during an otherwise very difficult period during this pandemic. This is one thing that emerging research shows is actually helping, particularly with regard to Suboxone. And it's permitted under a waiver that we have currently, but the waiver is, although, again, very important, and back home folks are calling it a game changer, the waiver is temporary. In fact, the waiver ends when the public health emergency ends. And I'm concerned, as we've been talking about today, that public health emergency would not continue. So what do we do about it? Well, one is you have the ability through HHS to issue a rule on this to permit this kind of telehealth. Again, the research is out there. It works. In 2008, you and I both support it. Actually, I was out of Congress at that time, but you were still in Congress. It was called the Ryan-Haidt Act, which gave DEA the authority and HHS the authority to issue a rule. 10 years later, they hadn't done it, so Congress in 2018 said, please do it, and then again in the Appropriations Act of 2021. So here we are 14 years later, and still we do not have this rule out. Senator Whitehouse and I are frustrated because we can't get technical assistance from your folks on our legislation, the TREATS Act. But my view is if we can't get technical assistance, which we'd like to have, at least if we could get this rule out, it would be helpful to have an administrative decision. So my question to you today is, would you commit to working with Congress to ensure we don't have an interruption in this treatment, particularly really important treatment like Suboxone via telehealth when the public health emergency ends?
Absolute commitment, Senator, to work with you on that. And I have some of my team here, and they heard that admonition you just gave about not being able to get certain technical assistance. We'll make sure that whatever you need, we'll try to get it to you. And as you know, one of these things that makes it more difficult is it's not just up to HHS. We have to work with our drug enforcement partners, and we look forward to your support in trying to get to all the different agencies that have to have a say in this.
Great. Well, thank you. I appreciate it, Mr. Secretary. We will follow up with you right away on that. It's been 2 years, by the way, of us trying to get the technical assistance. And in any case, you have the ability to do the rule, which I think is really important, that we have a law eventually, but immediately let people know that they can continue to get access to this medication-assisted treatment. Title 42 on the border. This is a mess. As you know, we have 7,000 people a day now coming across the border, which is historic numbers. These are unlawful migrants coming to the border and being allowed in, typically under the asylum rules, 7,000 people a day. We are turning away about half the people under Title 42. So another 7,000 people a day would logically be coming in addition to the current 7,000. However, DHS has told us it's more likely to be something like 18,000 a day because folks will come to the border. They're already doing so, apparently, knowing that this Title 42 is going to be expiring. That is moved from a crisis to a catastrophe, I guess you could say, because that's over 500,000 people a month coming across our border who are unlawful. So this is a huge problem. It exacerbates an already very difficult issue we have. Obviously, we need to do something to deal with the asylum policy, which is the underlying problem. But in the meantime, we need more time. I guess my question to you is, I'm wondering why CDC all of a sudden has decided that pandemic conditions have improved enough to terminate 42 when HHS is also asking us for billions of dollars. I think we're about to vote on a $10 billion package of emergency funding to address the pandemic, and you continue to extend the COVID-19 public health emergency, most recently in January, and I assume you'll do it again in April. So you maybe have been asked this already today. I'm sure you have. It's a big concern along the border and for all of us who live in states that are affected by what happens on the border, including the drugs that come across. Any thoughts on that, Mr. Secretary?
Plenty of thoughts, Senator. Thanks for the chance to try to clarify. Title 42 is authority that we have under law to address a health care emergency that relates to the need to quarantine, the ability for us to take measures which otherwise would not be lawful to try to keep Americans safe. That quarantine authority has been used very rarely, and it is for the purposes of something like this pandemic that we've suffered. The public health emergency authority that I have to declare a public health emergency throughout the country applies different law in different ways with different standards. And so that's why you see a different treatment of Title 42 and the public health emergency. What you talk about on the border is one of the conditions that was reviewed for purposes of Title 42. But Title 42 is not an immigration-related law. It's a healthcare-related law. When the science and the evidence tells us that we no longer need the use of quarantining authority under Title 42 because of healthcare conditions, then Title 42 must come down. That's why you see the actions being taken by the administration. The evidence based on the science is telling us where to go on Title 42. The public health emergency takes into account many other things beyond quarantining necessity and authorities, and that's why you see a difference. I will close by simply saying this. Using Title 42 for immigration purposes is a misapplication of the law. The president, for his first day in office, sent to Congress a proposal to fix our broken immigration system. That's where we need to go if we want to deal with the border situation that we have, not using a healthcare-related authority to try to deal with immigration challenges.
Time of the gentleman's expired. Senator